Welcome to Mind Your Mental Health channel, a channel for mental health awareness, psychological health and well-being. So far we have done 22 episodes in this channel and this is our 23rd episode. In this episode we are going to talk about phobia. Phobia is one of the anxiety disorder. Anxiety disorder predominantly presents with symptoms of anxiety. There are different disorders comes under the anxiety disorder, the broad category of anxiety disorder. One is generalized anxiety disorder, other one is panic disorder, third one is phobia. Then we also have post-traumatic stress disorder. In a short term we call it as a PTSD. We already talked about anxiety disorder, general introduction. Then we talked about generalized anxiety disorder. In the last episode, we talked about panic disorder. In this episode, we'll talk about phobia. Phobia is a very common term. We use it in our day-to-day life. Now, are you phobic to this? Don't be phobic. Now, there are different connotations we use phobia. When it comes to psychiatry, we are talking about a disorder, psychological disorder. If you want to define it in a medical parlance, medical term, it is an uncontrollable and irrational fear. And it is a very intense fear. So it is uncontrollable. You won't be able to talk to yourself and calm you down when you have that phobia symptoms. And it is irrational. The object or a situation which induces phobia in us is not reasonable. Now, it's such a small thing, such a simple situation or such a simple activity. It should not have, in normal circumstances, lead to intense fear reaction. But in phobia patients, they do produce uncontrollable, irrational, intense fear. That is not the only part of the phobia definition. There is another part to it. This fear, this anxiety leads to avoidance behavior. I'm not only scared of it, I'm not only fearful of that, I want to leave the place immediately or I want to avoid that object completely. Either a run away or never approach it, never get into that kind of a situation or never get into a situation where I'll be able to face that object. It could be a snake, it could be a rat, it could be a cockroach or it could be a spider, anything. But what it does is inducing fear and I'm leaving the place or I'm running away or avoiding. That is the most important aspect of the phobia. Okay, the next question will be, what are the symptoms of phobia? How do we recognize phobia? Now, all the phobic symptoms are similar to anxiety symptoms. Whatever we discussed in the introduction about anxiety disorder and generalized anxiety disorder and panic disorder, almost similar anxiety symptoms. The difference is where it occurring, what the situation is occurring, and the nature of the symptoms. If the symptoms last throughout the day, it is generalized anxiety disorder. If the symptom comes and peaks and then comes down, then you are completely alright, then it is panic disorder or what we call panic attack. Attack comes on, goes away, even without treatment, then it will come back again. That is panic disorder, which we talked about in the last episode. The next one is phobia, where the anxiety comes, symptoms escalate, leading to avoidance behavior. So let's see what are the symptoms. It could be a repetition of our previous episodes. So there are two sets of symptoms. One is somatic symptoms or bodily symptoms. Other one is psychological symptoms. Now, when I say bodily symptom, it is a reaction or what you perceive in the body. One of the important one is the palpitation. Palpitation or feeling that heart is running fast or pounding of heart. Usually, we don't perceive heartbeat. We don't feel the heart beating. It beats about 70 to 80 minutes. But we don't perceive it. It goes on from the time we are born till the time we go away. But when the palpitation comes, when the fear comes, you start feeling that your heart is beating, now beating rapidly. So accelerated or increased heart rate, and you perceive the heart rate or heartbeat. That is one of the symptoms. Then you perspire, you sweat. It happens in normal anxiety. It will be very intense in the phobia. So you might be drenched with sweat. Then comes tremulousness or tremors. Whole body can shake in intense fear, or your extremities can shake. Your hands might shake, or your legs might shake. Sometimes the shake be so intense you feel like sitting down somewhere. You won't be able to stand. So shake is so much, depending on the intensity of the fear. Then your mouth goes dry. Now your mouth, your tongue, everything becomes dry. In fact, it leads on to difficulty in speaking because you're not able to pronounce things because your mouth is dry. Then other symptoms are breathing. Now, so they feel they are becoming breathless or rapid breathing. Now, our respiratory rate goes up. Every time I have a fear, I feel like I'm choking or breathless. I'm short of breath. That is another symptom of bodily symptom of anxiety. Then the breathing, the rapid breathing also leads on to choking sensation. But you are not actually choking, but it is a sensation what you have. Choking is different. Let's say that's a life-threatening situation. I'm not talking about that. I'm talking about anxiety-induced feeling of a choking. Okay, then people can also experience chest pain, discomfort, some aches and pains in the chest area, or they can have some uneasy feeling in the stomach, especially in the epigastric region. Very uneasy feeling. Something is going on there. What we call butterflies in the stomach. That's also another bodily symptom. These are all mediated by a subtype of nervous system called autonomic nervous system. I have talked about this in one of the earlier episodes. And they can have abnormal distress. They can also feel like vomiting, feeling sick. They might have nauseating feeling. All these things are part of anxiety symptom belonging to the body, bodily symptoms of anxiety. Then psychological symptom. The very common symptom is fear, intense fear, feeling of that fear, apprehension, something is going to go wrong, something is going to happen to me, I'm going to die, or that's going to hurt me. I'm looking at spider, it could be poisonous spider, it might kill me. All those kind of negative thoughts and apprehension about the safety, about ourselves, the person who's suffering. So that is one of the psychological symptoms, apprehension. And they also feel that as if they are losing control. I am going to go berserk. I won't be able to control myself. So that fear comes in again. And sometimes they also feel, am I going crazy? What is happening? So, and they also feel like they are going to faint. Sometimes people faint. They pass out. So that's again a symptom of anxiety. And fear of dying, all those things, naturally you have a breathlessness, choking sensation, and you feel fear and intense fear, and you might feel, oh, am I going to die now? That's why people with anxiety disorder need some kind of a health. They need to go to somewhere, emergency department, or go see their doctor. They think, I'm something wrong with my body, I'm going to die. They immediately need to see someone. So other than that, there are certain general presentation like chills and hot and warm feeling. Now, sometimes they have a feeling that comes somewhere in the body and spreads all over the body. They feel very warm, somehow warm feeling in the body. It's unpleasant. It's not warmth we are talking about. It's an unpleasant feeling of warmness. Or they can feel very chill. The extremities can be very cold and clammy. Now they feel very chill. Sometimes they feel a tingling sensation in the hands and legs. Mostly in the hands. The tips of the fingers might feel very tingling. Some pins and needles feeling. Tingling sensation. Sometimes they feel they're going numb. In the height of the anxiety, height of the emotional disturbance, they feel they are going numb. These are all symptoms of anxiety. It can happen in any kind of a anxiety disorder. It will also happen in phobia. The difference is, in phobia, it is directed to an object or a situation or an activity. So that is the important. So the symptoms are same, but depending on how it presents, what it presents, that's where the difference comes. So what we have is a phobia where anxiety symptoms are there, like panic attack, like general anxiety disorder, but they are directed to a particular situation or an activity or an object. It could be animal, it could be insect, it could be anything. Lightning, thunder, anything can induce phobia. Okay. So we talked about phobia, general description, and then I talked about signs and symptoms. Your next question will be, what causes phobia? I explained in other episode, in a mental illness, there is not a single cause. It is multifactorial. Different causes, different situation leads on to mental illnesses. They are called as biopsychosocial causes. So bio means bodily changes. It could be changes in the neurotransmitters in the brain. Psychological, psycho means psychological, psychological. That is the personality, how they are made, and what are their experiences, and what is the psychological makeup. All those things can contribute to mental illness. Then social factors. It could be relationship problem, it could be financial problem, anything, any social reasons can also induce or cause a mental illness. In phobia also, there are different causes. One of the causes of phobia is learned response. What it means is we are learning some response. This comes from the concepts of behavioral or behaviorism. What behaviorism tells us is all our activities, most of the things what we do is learned. We learn from different sources. The first few years of our life, we learn it from parents, siblings. Then we go to school, we learn from teachers and classmates. So we are in a continuous process of learning. As we learn good things, we also learn bad things. As we learn to be courageous, we also learn to be anxious or phobic about few things. That's basically what learned response is. So a child has learned. When an adult sees a snake, it can induce a fear response, or they can be phobic to snake. That comes from the knowledge or information they have. Snake can be poisonous and they can kill us. So we need to fear, or either we need to attack or we need to run away. If the fear is more, paralyzing fear, that is phobia. If I run away, that is phobia. So phobia for snake. This phobia didn't come suddenly. It would have come over a period of time. From my childhood till date, I've learned somewhere to fear the snake. How did it happen? Probably as a child, 2 years old child, if you present the snake, I might just hold it without any fear. I might even play with it. But if somebody gives me a snake when I'm doing my uni, by the time I would have learned that snake is a dangerous for human life or any life that matter, and it can kill. That leads on to intense fear. Now that fear could be controlled fear. I might, if I see a snake, if I see a cobra, poisonous snake, I might fear, but I might still stay here, try to manage what to do. Now call for help or how we can do. Something goes on in your mind, but I'm still there. If I am phobic, if I see a snake, irrespective of it's non-poisonous or poisonous, whatever it is, the very sight induces intense anxiety in me, fear. Fear is so intense I can't think. Only thing which comes to my mind is I'm going to die because snake is going to bite me. Now that leads to escalation of anxiety, then immediately run away. That is avoidance behavior. So this behavior I learned somewhere down the line from my childhood to adulthood. That is what the learned response is. Now another cause which researchers say is trauma or incident in the past. Something which has happened during your childhood, adult period, that can also induce phobia, depending on the personal makeup of that person. In a vulnerable person, the trauma, a particular incident can induce phobia. For example, a person who is a quite casual driver and handles cars very nicely, there is no problem, and meets with a very dastardly severe accident. That accident can leave a very, very strong mark on him. Either they can go in for a PTSD, or they can go in for a phobia for cars. Now they might completely avoid driving because they think that driving is going to be harmful for me. I might hurt myself or others, and they can avoid. So intense anxiety about driving, thought process, then don't do that. Avoidance. And researchers also say that long-term stress, where you're kind of locked into a stressful situation, you're not able to kind of get out of that, and long-term, these things can also induce phobic reactions. And early childhood experiences, of course, I mean, when you go through a very traumatic experience in the childhood, can precipitate or induce phobic reactions. And of course, as in many other mental health conditions, genes or hereditary plays a role. When I say genes play a role, it doesn't mean when a father has, son should have it. What the son or a daughter inherit is a propensity to develop phobia. If a father has phobia, son might have a propensity to develop phobia. That doesn't mean he will develop phobia. He only has a propensity. He might develop depending on the other factors. Suppose he has gone into a very severe accident, then he avoids car. That becomes a phobia because there is a gene which can express at a particular time. Otherwise, father having a phobia, son or daughter may not have phobia for their lifelong. So, but genetics does play a role. And then, of course, almost all the mental illnesses, we talk about neurotransmitters. Neurotransmitters are chemicals in the brain. They are the one which kind of enhances the functions, and it is the functional units of the brain. Now, that's where all the functions take place, neurochemical functions take place. When there is imbalance of these neurochemicals called as neurotransmitters, that can also lead to mental illnesses, that can also lead to phobia. So we talked about phobia, signs and symptoms, and causes of phobia. Next is types of phobia. What are the types of phobia? There are three types of phobia: agoraphobia, social phobia, and simple phobia, or we also call it as a specific phobia. The phobic symptoms are same. Now, what are the anxiety symptoms, whatever I enumerated? We differentiate by what situation induces the phobia, or what object induces the phobia, or what activity induces the phobia. So let us see what is agoraphobia. Agoraphobia is hallmark of agoraphobia is anxiety, intense anxiety or fear in various situations arising from thoughts that escape may be difficult from that situation, or they may not be helped in that situation. Then that can lead to phobia. That can lead to intense anxiety about even thinking about that situation, and that lead to avoidance of that situation. I said situation. What are the situations? There are a few general categories of situation. One is crowds. When you go into a place where a lot of crowds, that is one. And public places, when you go into open public places, where just walk into a very big open public place, that kind of situation can induce phobia, agoraphobia. And traveling alone, I might have to travel by 4 or 5 hours now by train or by bus or by flight. Now I'm going away, I'm traveling. That can induce phobia. And traveling away from home, I need to go away for a couple of days from home, or I need to go on holiday for a week. My children have booked a lovely place for me to go, but the agoraphobia, if I have agoraphobia and for traveling, then I will not go, I will avoid. That is avoidance. So this, I've given you just 4 examples of places. Now you might ask me, how exactly it will produce phobia? It is in the mind, the thought process. Now, let's take, for example, now, my daughter calls me and says, can you go to the high street? There's one particular shop. I want something from there. Can you go pick it up, daddy? Now, if I'm a normal, there's no anxiety, there's no other problem, I will just go pick it up. If I'm suffering from agoraphobia, if I'm suffering from agoraphobia, which is related to the crowd or open spaces, the moment I hear those words, can you please go out to the high street, my anxiety kicks in. And it starts increasing seconds, minutes and seconds by seconds. So what I will think is, if I go to this high street, it's open space, high street, there are many people around. If I get into some kind of situation where I can't escape and I can't immediately return back, then what happens to me? That's a fear. Yeah, and that's a strange place. Nobody is going to be there. I mean, whom I know. My daughter is away, and there won't be any help if I get into some kind of a difficult situation. Either it's because of fear or something else. And then my anxiety increases further and further. It increases and it peaks. I might get panic attack also. So phobia can occur also with panic attack. So phobia can occur with panic attacks also. So the agoraphobia, thinking about going to an open space or going to a crowded high street, and the thoughts increasing my anxiety, it peaks to a panic attack. Then I will decide, no, I will not go. I know doctor is not going to be happy with me, but I will not go. The moment I take decision, the moment I am sure that I'm not going to go out, my anxiety comes down. I'm completely all right. As far as I remain at home, in the safety of the home, I am fine. I will not have any symptom. But the moment a task is given or object is shown which is going to induce phobia, then I become phobia. So going into the open space, going in a crowded place, all those things can induce agoraphobia. That kind of fear is called agoraphobia. Okay, so what are the prevalence rate? Now, agoraphobia seems to be very common among women. The research says that 70% of the patients whom we see as agoraphobia could be in women. If I get 100 patients with agoraphobia, 75 of them will be a woman. And the age of onset is around adolescent, late adolescent and early or mid adulthood. So say between 15 to 35 years of age, that is the time they develop this phobia, agoraphobia. And risk factors are stressful life situation. They are going through very stressful life situation. They lose confidence in themselves. They think they can't handle themselves. They can't do any task. Those kind of situation can lead to agoraphobia. And if there is a family history, as I said already, hereditary gene. And some of the research say that if there is a family history, a father or mother suffers from phobia, 20% of the relatives, depending on what degree they are, can develop phobia. Again, depends on other situations. It's not that definitely it will come to the next generation. And domestic or family instability. A child growing in a very unstable family, very emotionally expressed family can also probably develop phobia. And history of childhood fears. All of us have our childhood fears. It could be anything. It could be thunder. It could be a loud noise. There are so many things we fear as a child. And that history of childhood fears later on can become a phobia in certain instances. And some of the research also said that overprotective families, where they are overprotective about the child, they don't let the child expose the natural events, now experience certain things and learn to manage their anxiety. These kind of children can also go into a disorder, phobia disorder. It could be agoraphobia. So these are all some of the factors we need to know about agoraphobia. Next comes the social phobia. This is another type of phobic disorder. Symptoms are same, only situation changes. So what happens here? Here the fear is about being in attention, being in focus of something. And in that being in attention, being center of focus in a crowd, and then a fear if I may behave stupidly, or my behavior is silly, or some embarrassing behavior I make, then how bad it will be, how humiliating it will be. That is the fear they have. Social situation. In a social situation, I'm going to make fool of myself. That is the fear they have. That is a social phobia. That leads to marked avoidance in any kind of situation where they might be exposed to focus and attention in a crowd. Suppose a friend calls me for a party. He comes around and say, I'm having a party, birthday party. I invited about 15 or 20 people. Many of them you may not know. Some of them you might know. I would like you to come. Now, if I am a normal without any anxiety, then I will jolly well go to the party. Now, if I have a social phobia, then my thought process will be, God, he's a close friend of mine. He asked me to come for a party. Now, there are about 20 people, I believe. So he's going to introduce me, and then I'll be the attention there. I'll be, at least for some time, I'll be the focus. Now, when he's going to introduce me as a very close friend. Now, if I behave something abnormally, if I do something silly, I'm going to be a laughing stock. And how humiliating it's going to be. I can't get away from that kind of situation. That thought doesn't stop. It escalates. It increases anxiety. Anxiety increases a negative thought. Negative thought increases anxiety further, and it is a vicious cycle. And it peaks. At the peak of it, patient will be suffering. And the thought comes, why should I go? Okay, let me not go. The moment they take the decision, I'm going to send my apology, I'm not going to go, anxiety comes down, they come back to normal. So at home, they'll be completely fine. As far as there is no social situation, they are fine. So the number of people suffering in the community much larger than what we see in our treatment centers. Many a time it goes unnoticed by others. I'll quietly say I don't want to come. It could be because of social phobia, or it could be something else. So many a time people cope. People try to manage their social phobia. And we don't get the patient very often directly. Nobody goes to GP and says that I fear going out to a crowded place or going to meetings or giving a talk or something like that. Doesn't become a complaint in a physical sense or to go to the doctor. They think, okay, that's I am. Now I'll manage. So social phobia is one of the common phobic symptom. Next is how common it is. Social phobia is common among men and women. So there is no kind of, unlike agoraphobia, they are equally distributed. Onset is, most of the phobic onset is adolescent onset. Prevalent rate is 1 to 2%, but that is higher than the agoraphobia. That's why I said all the patients having a social phobia don't come to the treatment centers because they cope. Somehow they manage, avoid things, and then they structure their life according to their phobia. And many of these phobic patients can also suffer from comorbid or associated problem. One of the problem is depression. They can develop depression because of the disability it produces. It can be highly disabling phobic disorder. That can lead to kind of a reactive type of a depression, or these people might learn some very maladaptive coping behavior. For example, alcohol. A friend would have said, when you go for a speech, if you feel so anxious and you don't want to go, take a couple of drinks. Now you will be fine. He would have tried it. He might have find very little kind of a relief. Then he will start using that regularly. It will not stick 1 or 2 pegs. It will go to half a bottle, 1 bottle, several bottles. Then we are looking at alcohol dependence here. It may not stop with alcohol. It might also go to drug dependence. So the phobias can develop maladaptive behavior leading on to other problems. So that is about social phobia. The third one is specific phobia. We call it as a simple phobia. It is simple because the definition is simple. It is phobic to particular object. It could be animate, inanimate. It could be animals, reptile, it could be anything. So specific objects or animal or a situation produces phobia. It's a marked fear, as I explained in other phobias, intense fear peaking, sometimes leading to panic attack, and mostly and all the time leading to avoidance behavior. That is very important. Avoidance to that specific object. It could be anything, that specific object, and it could be situations also, specific one particular situation. Among the objects, we can group them into different subheadings. Now, we can't group everything. Some of the objects we can group. One is animal type. So it could be any animal. Now, you can be phobic to any animal. Now, you can be phobic to cats. You can be phobic to dogs. And the next category is natural forces. Nature and natural forces. Thunder, lightning, all this can induce phobia. Then bodily fluid, sometimes, most importantly, blood. Now, any bleeding, any injury with the blood, and fear of injection, when they see the needle going in and blood coming out, all those things can lead to phobia and complete avoidance. They will refuse to take any injection. Even we have seen in the life-threatening condition, they refuse. Now we need to look at the capacity and make a complex decision about administering all those things. And situational type, where particular area can be phobic to them. These are some of the broad categories of phobia. Now, if you want to give a name for each phobia, for specific phobias, you'll have hundreds of names. There are names for specific phobias. I'll give you some of them to make it a little more interesting. Animal phobia, we have a term called arachnophobia. There was a movie by name Arachnophobia. I don't know how many of you have seen that. I think it's about tarantula spider. So arachnophobia is fear of spiders. So what they have done is they have taken either Greek or Latin name and then added phobia to that. Arachnophobia. Cynophobia is for dogs. Entomophobia is for insects. Now, it could be anything. It could be any insect. Now, bees or anything, they fear intense fear. And ophidiophobia is for snakes. So these are some of the terminology we use. Natural environment. Now, so aquaphobia. Now, aquaphobia is for, as you have guessed, water. Fear of water. They may never go on cruise again when they have this phobia. And astrophobia is about celestial things like lightning, thunder. These can induce very intense fear in people. These are all to a certain extent common in childhood. Now, most of the children would have had that fear when they see the lightning or when they hear the thunder. But when it persists into the adulthood and it leads to avoidance, it leads to kind of a disabling situation, then we call it as a phobia and then probably think about treatment. Situation wise, one commonly used terminology, what commonly we use it is claustrophobia. Claustrophobia is a fear for closed places. If you are in a completely closed room, then they develop fear. What's going to happen? I'm alone. Everything is closed. If I'm not able to get out, what will happen? I might die. Then anxiety kicks and increases. Now, another classical place is lifts. When they get into the lift closes, they'll feel suffocated. They feel immediately they need to get out. They need to stop. Even if it is emergency stop, doesn't matter. They need to get out. That kind of a phobia is that. Now, it can be very disabling. For example, let's see, I'm working in the 33rd, 4th of the building where my office is. And I have a claustrophobia. Then how will I reach there? Every day I'll have to climb 33 flights of stairs. So it can be disabling depending on your life situation. So claustrophobia is not very uncommon. People manage without coming to the treatment. And nyctophobia, this is fear for darkness. Again, which is common during younger days. Children have that. Sometimes adults also have that. If it is not intense enough, it is not affecting your day-to-day life, it is not disabling, then probably it goes unnoticed and probably there is no need for a treatment. Not that every phobia need to be treated. So we have seen almost all the aspects of phobia. Only aspect which I haven't talked so far is about treatment. Treatment is also multifactorial. We don't stick to one treatment. We might rely on medication for certain symptom relief, but we also add other therapies. So important, most effective treatment for phobia is psychological therapy. In that, there are two therapies which are more evidence-based. There are good evidence to say that these therapies work. There are any number of therapies, hypnosis, there are many therapies, but we don't have a strong evidence for those. Individuals who is practicing it might have some success, or they might have a good success, but it is not recommended probably in an NHS kind of setup. Among the therapies, I said two therapies, cognitive behavior therapy and exposure therapy or systematic desensitization therapy. These two psychological therapies are quite effective. Cognitive behavior therapy is an excellent therapy and indicated for many of the psychiatric problems or disorder. It can be used for anxiety, depression, many psychiatric conditions use CBT. It's a very effective therapy. It is mostly one-to-one. They also have group CBT, and they can also have now computer-based CBT. There are different modalities available, and it is an effective treatment. Next one is exposure therapy or systematic desensitization. The principle, it's based on the behavioral principle. We said phobia is a learned behavior, learned response. Anything you learn, you can also unlearn. It has been proved by experiments, behavioral experiments. So anything you learn, you can also unlearn. That principle is used in exposure therapy or systematic desensitization, where the phobic object is very gradually introduced into the patient's environment. Initially, it is done imagery wise. They are asked to imagine. Suppose I am, let's say, phobic to spider. Imagine, think about, visualize spider. At the same time, the moment I start visualizing, my anxieties go up. So therapists will manage that. Relaxation therapy, the many methods are there to manage that anxiety. So anxiety mounts, anxiety is reduced by therapists. Same time, the imagery is in there. Once they are comfortable to certain level, then actually the spider, either photograph or object looking like spider can be introduced, and it can be introduced, spider itself can be introduced at distance, and therapy stays and then manages the situation, and then slowly the spider is brought nearer and nearer. It reaches a stage where with a little bit of anxiety and fear, the person is able to touch it. So it goes on like that. That is one of the effective treatment. There are many other treatment. One treatment is called implosion or flooding. We don't practice those kind of a treatment now. These are the two evidence-based treatment. In addition to that, medication, mostly we use antidepressant. We don't use the benzodiazepine because of the addiction potential. There might be some situation, but by and large, we don't give long-term medication, benzodiazepine-based medication. So most of the time, we use antidepressant, especially SSRI and SNRI. These are groups of antidepressant. They are quite effective in managing anxiety symptoms. So these can be used. There are a few other medications that can also be used. So medications are available. Effective medications are available. We can use them. So usually we start them on medication, refer them for therapy, and medication and therapy together helps the patient. Okay, so this episode we learned about phobia. Next episode we'll be talking about PTSD, post-traumatic stress disorder. This is another very important disorder to learn, because it can also lead to quite intense suffering in the person who suffer from this. So we will talk about it in the next episode. Thank you very much for being with us. See you on our next episode. And if you like it, subscribe to our channel. And if you think your friends, relatives might benefit from it, please do share it. And we also welcome comments. Thank you. Bye.